Hi, my name is Dr. Suzelle Hench, and I'm one of the obstetricians here at Bacchus, and I've been asked to talk today about hyperemesis and morning sickness. There's been a lot of press recently about Princess Kate being hospitalized for her morning sickness. From what I can tell, it sounds like she has a condition called hyperemesis gravidarum, which affects 1 to 2% of pregnant people, and it usually starts in the first trimester and can last for a long time. The signs of severe morning sickness, also known as hyperemesis gravidarum, are weight loss greater than 5% of your pre-pregnancy weight, inability to keep any food down, and severe dehydration, which can show up as feeling lightheaded, dizzy, urinating less frequently, and it can look more concentrated. The most common reason that people are admitted to the hospital in the first trimester of pregnancy is hyperemesis gravidarum, and it's second only to preterm labor as the most common reason people need hospitalization throughout the pregnancy. So morning sickness, if it's mild, can be in the morning. It can sometimes be in the evening. If it turns into a severe case, like Kate had, which is called hyperemesis gravidarum, it's throughout the day and may require hospitalization for IV hydration. Hyperemesis is more common in twin pregnancies. If it runs in the family, you're more likely to have hyperemesis. Female babies tend to have higher cases of hyperemesis. And if you have a previous history of motion sickness or migraines or reflux, you're more likely to get hyperemesis. Usually we like to see hyperemesis because it usually means that it's a healthy pregnancy and is less likely to end up as a miscarriage. The only risk with hyperemesis and pregnancy is that the babies can end up being on the small side, so we tend to watch the pregnancies more closely with serial ultrasounds to look at the growth. Today I'm going to talk about treatments that you can do at home for morning sickness. So there are various treatments for morning sickness. The most common treatment we recommend is just dietary changes to avoid fatty foods and spicy foods and increase your protein intake, to eat frequent small meals every hour or two during the day, and try to avoid drinking lots of liquids that make you feel full and make you feel like you need to vomit. Some over-the-counter remedies that you can try are ginger capsules 3 times a day, or you can try vitamin B6, 25 milligrams 3 times a day. Some people try Unisom, which is over-the-counter sleep aid, and you take half a tablet at bedtime and then during the day if necessary. If these over-the-counter remedies don't work, then you should call your doctor and they can prescribe medication for the nausea and vomiting. A lot of these medications can be either taken by mouth, or they also make suppositories in case the nausea is so bad that you're not even able to hold a pill down. And then once in a while, if those medications don't work, then we have you come in for IV medication and hydration. Usually the signs we look for dehydration are if you can't hold anything down for 24 hours, if you're urinating very small amounts that look very concentrated, or if you feel lightheaded, dizzy, or if you notice that your pulse rate is really high. There are other remedies out there that have been tried and have varying results, and they include wearing C-bands, which puts pressure on the point that helps control nausea and vomiting. Some people have tried hypnosis, and some people have even tried an electrical stimulation device to stimulate the nerve to decrease the nausea and vomiting. And this does work for some people. So the bottom line is that it's very important to treat nausea and vomiting early when it starts so it doesn't develop into hyperemesis. At the end of this video is a list of remedies that you can try at home for nausea and vomiting. For further information, please feel free to contact your obstetrician. Thank you.